Hi. Today I'm going to be talking about vitiligo, which is an autoimmune disease of the skin. So there are 5 different types of vitiligo, but generalized vitiligo is the most common. So generalized vitiligo causes loss of pigmentation, that encompasses pretty much the whole body, and it increases with symmetry. So if you got it on your left arm first, then you would also get on your right arm additionally. With universal vitiligo, it's basically everywhere on your skin and will just result in complete depigmentation. Segmental vitiligo occurs on only one side or one part of the body. And it usually occurs at a younger age, and it will stop spreading around 1 to 2 years of having the depigmentation. But although it does stop spreading, it doesn't mean that the depigmentation that your skin color will come back. Then the next type is localized vitiligo or focal vitiligo, which affects one or more areas of the body. Acrofacial vitiligo affects the face, hands, and body openings such as the eyes, nose, and ears. So this is a picture of the different types of vitiligo. So as you can see in the universal one, pretty much all the pigmentation is gone. And then you can see for the different types where it affects the body. So the exact mechanism of induction for vitiligo is unknown. All they know is that it's due to the disappearance of melanocytes, and that which of those cells are ultimately in charge of our skin color and how much melanin we produce. And this response is triggered by the white blood cells usually attack the melanocytes, but they're not really sure as to what exactly causes it. But they know the trigger events can be stress, skin damage, or exposure to certain chemicals. Vitiligo is also very genetic, so they know that if your parents had it, then you have a more likelihood of getting it as well. So incidence and prevalence. It exists in around 1 to 2% of the US population, and because of the genetic, because it's so genetic, 30% of people with vitiligo have a family history of it. And then 20 to 35% of people that have vitiligo are children. And it's not as prevalent in the world. It's 0.5 to 1% of the world population. But I think that could be due also to not reporting as many cases as they actually are. Anyone is capable of getting vitiligo. It doesn't really matter your age or anything. Because really you could have any of those stress factors at any time. Signs and symptoms. So as I said before, pretty much you just it's patchy loss of skin on the hands, face, areas around the body openings. And then further progression depends on which type of vitiligo you have. It can also affect the hair and cause whitening on the hair follicles. It is also more noticeable in people with darker skin because whenever they lose their pigment, you can tell because there's a larger contrast, as you can see in the picture on the right. And then people with lighter skin, you can't really tell as much. So some risk factors of vitiligo is family history of vitiligo, family history of other autoimmune disorders. If you have another autoimmune disorder, having melanoma or non-Hodgkin lymphoma, and if you have genetic changes that are directly linked to generalized vitiligo. So any of these factors could also add to the additional risk, not the risk factors, the trigger events. So if you have these with the trigger events, you have a pretty high likelihood of getting vitiligo. So in order to diagnose vitiligo, the doctor often will ask you questions such as about your family history, whether you've injured that part of the skin before, or if you tan or burn easily. And then to ultimately tell if it's vitiligo or a different type of depigmentation, the doctor will use a Woods lamp, which is seen on the right bottom picture. It's an ultraviolet lamp that is used to look at the skin in more detail. So the lamp is usually used in like a darker room, and it's usually held 10 to 13 centimeters away from the skin. And then you can see in the top right picture that the spots of vitiligo like show up way more in like from the lamp. So through this, the doctors are able to like differentiate between vitiligo and different types of skin. So treatment. It depends. So for the treatment, it depends on the person's age, and it progresses, in the progression of the disorder, and it affects different parts of people's lives and different parts of like part of the skin it affects. So there's no cure to this disorder. So really all these treatments are like, it varies with each person. Because there's no guarantee that any of the pigmentation will come back regardless of the treatments used. But medication can be used, such as corticosteroid creams and light-based therapies to help try to like even out the skin tones. Tanning products or makeup can be used to try to cover up. And then sometimes multiple therapies can be combined to have a positive effect and restore the skin tone, but ultimately some of those can cause some types of side effects and ultimately cause it to be worse and progress more. If the treatments work, a medication is often applied to try to prevent new patches from growing, but there's no guarantee it will work since there's no cure. But vitiligo does affect a lot of people's emotional states because it pretty much singles them out from the rest of the population because it's very noticeable, especially if you have dark skin, as I said before. So a lot of those people that it is more noticeable, they have to go to like therapy groups and stuff like that to learn how to like cope with it and work with it in society. Usually the most common like treatment is the tanning products or like corticosteroid creams, which try to like keep it from progressing further. Rarely people use surgery, but it's not really used ever because surgery is very harsh, and really you shouldn't want to do surgery unless you ultimately absolutely need it. But some surgeries that are included is skin grafting, which they'll just take a part of a different part of skin and then put it on the spots that have vitiligo in hopes to like help with the melanocytes and the production of melanin in those parts. Another thing is blister grafting, which they create blisters on pigmented skin and then they transplant those onto the patches that are depigmented. And then there's also cellular suspension transplant. So cells from the pigmented skin are put into solution and transplanted onto the depigmented area. And then results usually show up within 4 weeks. But as with any surgery, it comes with risk, and it could produce more scarring, infection, and it could produce more discoloration. So really this should be used as a last result, and it's really never used because vitiligo is non-life-threatening. So complications of vitiligo. So people with vitiligo are at a greater risk of developing different types of complications, such as social or psychological distress, as I said before, because it singles them out from the rest of the population. And like my nephew has it, and people point and stuff, like because they're little and they don't understand. So especially kids, like they get affected by this a lot because children don't understand what it is. They don't understand if it's contagious or anything like that, which it's not. And yeah, so children with vitiligo are very like harmed by this psychologically, so they really need to seek like therapy or just help from an adult. But even older people like with vitiligo need to have some type of like person to talk to like relieve some stress about it. Additionally, they're at a greater risk for sunburn. So when they go to the beach, sometimes they'll wear longer sleeves if it's on their arms. So like wear long sleeve bathing suits to help to protect themselves. And then eye problems. So you can wear sunglasses to help protect from that. And then hearing loss, which I wasn't really sure how the hearing loss is a factor in it, but I read that it was. So although vitiligo is a non-life-threatening disorder, it does affect many people's lives, and there's no cure. But there are many medications and therapies that will help people with this disorder. Thank you for watching.